So let me start with a little overview of Pacritinib to put things in context. So Pacritinib is a JAK2, IRAK1 and ACVR1/ALK2 inhibitor that was approved by the FDA a little over a year ago, actually about 15 months ago, for patients with myelofibrosis and severe thrombocytopenia, which is less than 50,000 platelets. Now, we've increasingly recognized that patients with cytopenias are harder to treat in myelofibrosis when you consider the entire spectrum of patients. And clearly Pacritinib, because of its non-myelosuppressive nature and also its ability to improve anemia in some patients, has been a very welcome addition to the armamentarium, especially when it comes to patients with lower blood counts. So clearly, Pacritinib is a drug, I think, that is best suited to cytopenic patients. However, I think the point of this abstract is to note that Pacritinib retains efficacy sort of across the spectrum of blood counts. So what was done here was that the original Pacritinib phase 3 studies, PERSIST-1 and PERSIST-2, were pooled together, and all the patients were sort of analyzed together to see what Pacritinib really does in patients who are cytopenic or not cytopenic. So, for example, platelets less than 100 or over 100 were looked at, hemoglobin less than 8, over 8 were looked at. And it's important to remind our listeners that PERSIST-1 employed 400 milligrams daily, PERSIST-2 looked at both 400 milligrams daily and 200 milligrams twice a day, which is the approved dose of Pacritinib. And then the populations were also a little different. PERSIST-1 was JAK inhibitor naive patients, and PERSIST-2 were patients who may or may not have had a prior JAK inhibitor and had platelets less than 100. Of note, neither Pacritinib study, or frankly none of the Pacritinib studies, have really employed any lower limit for the platelet count because of its non-myelosuppressive nature. They've allowed any degree of cytopenia. So coming back to this abstract, what it shows is that the spleen and symptom benefits are essentially preserved across the spectrum of blood counts. They're not by any means restricted. The benefits are not restricted only to cytopenic patients. However, one acknowledges that this is a pooled analysis of two fairly different studies. I'll just sort of highlight that while Pacritinib rightly in many of our minds is a drug for cytopenic myelofibrosis, clearly that's its main home. That's where it is distinguished from other JAK inhibitors and has its greatest efficacy. I think this abstract serves as a reminder that it also performs quite well in patients with higher blood counts in terms of both spleen and symptom responses. So Pacritinib is an approved drug, right, like I alluded to. It's at least in the US, it's not currently in any trials. There is a confirmatory trial going on outside the US. But I think while there are no real next steps to talk about in terms of the trials themselves, I think the point here is that this is a sort of a different look at Pacritinib to see what really happens to the efficacy in the non-cytopenic patients. And we are, what we find here is that it is preserved across the spectrum of blood count. So that's the main takeaway.